Could you, Tara, could you help me just for a second? Do the name of the group, the name of the web company or whatever it is.
Oh, okay.
Could you just get that for me real quick? If you can bear with me just a second here. We're gonna, yes.
Slide water.
Pardon?
Slide water.
Where is it?
Chelan County.
Okay. Okay, thank you. All ready? Good afternoon. I'll be joined today with Secretary of Health John Weisman to answer questions after I have a chance. And actually, he'll make some remarks after I conclude. In case you missed some headlines, there was an important decision by the federal judge in Spokane yesterday. The court firmly dismissed a court challenge to the use of the state of Washington through the governor's emergency powers to curb the spread of 19. That was challenged, and the court, in quite strong language, dismissed that challenge. This is great news for the state of Washington because it allows the state to continue to protect that which is most precious to us, which is the health and safety and lives of Washingtonians. I should note that the state of Washington has not lost any of the challenges that have been posed to date in any of the lawsuits, and I would expect that record to continue. I've been alerted that the plaintiff in that case, Slidewater of Chelan County, has been operating in violation of that order, and we can expect that through the Department of Labor and Industries, there will be penalties associated with that noncompliance. I want to thank the Attorney General's office for working on this. This saves lives, and I want to thank our counsel, Catherine Leathers, who's been working on this day and night for several months to draft these orders with the utmost respect for the U.S. and state constitutions. As I've said, we've had enormous adherence to our orders. I want to thank Washingtonians who have stepped up to the plate. It is unfortunate that there's a few folks that have endangered other Washingtonians by their risky behavior, and we simply cannot allow that to continue. So we have some good news today in this effort against the COVID pandemic. We know we have problems in this state right now, but we know that they can be addressed by individual action and restraint. We know that we as individuals and as family members can take action to reduce the scope of this pandemic. Now, we've had some new challenges in that regard. We are hearing from local health officials around the state that the disease is now most commonly spread at social gatherings, face-to-face meetings of a whole host of contexts which involve our individual social lives. We see it happen sporadically across the region, and as a result, our weekly averages of the number of Washingtonians who are infected has continued to rise in a very disturbing pattern of continual, consistent increase. I want to show you the 7-day rolling average, which is 629 cases a day. This is the highest number throughout the entire pandemic. Now, I mention this because this might be a surprise to many of us who had the sense that after we were over the original hump, we would be in safe territory. Unfortunately, that is not the case. This has continued to rise consistently for the last month. Today, if I can show you another graphic showing the extent of the daily viruses per 100,000, infections per 100,000. The cases per 100,000 of our population are going up statewide as well, which you can see in this graphic. And you'll note that the rate of increase is quite significant. The angle of attack, if you will, of the line on the right going up is almost as steep as it was in the original days, and it is twice as high as during the first onset, if you will, of the virus. So here's what we know. This shows that too many individual citizens, regardless of their age or their ethnicity, are simply not exercising the caution that is necessary if we are going to arrest this very, very dangerous rise of this pandemic. Hospitalizations are also going up. Deaths are also going up. And we simply do not want to see scenes in Mukilteo or the Tri-Cities or in Olympia that look like Arizona and Texas today. In those states, those communities are having to bring in refrigerated trucks for people who've lost their lives because of the onslaught of this pandemic. And if these trends were to continue in our state, at some point we would be in that situation. And that is not anything but reality that we face right now. So if we are disturbed of the scenes we're seeing in those southern states that opened up their businesses much earlier than the state of Washington, we simply have to find another strategy or additional strategies to arrest this pandemic. So today we are acting to take action in that regard. Here's what we're going to do today. Social gatherings of 5 will remain in effect for those counties that are in phase 2 and modifies phase 1, which is in most of the state today. But today I'm announcing a change to those counties that are in Safe Start phase 3 and those counties that someday could be in phase 3. This will limit all social gatherings to no more than 10 people a week. And that is something that we simply have to do if we're going to arrest this pandemic. Additionally, we are prohibiting all live entertainment, indoor and outdoor. Now, that's tough. We understand this. But if we are going to reduce movement of people and cut down on the number of face-to-face contacts, these are necessary and reasonable decisions that we have to make. The orders will go in effect Monday. I'd like to, if I can, talk about the social settings that are now of such concern to us. Here's what this means. Basically, it means that you really can only be with 5 people outside of your household in about 80% or 85% of the state. And in those relatively small numbers of counties that are in phase 3, it's only up to 10 people in those counties. And these are individual things that we all can control. And when we do that, when we do have those meetings, social distancing is absolutely imperative. Doing things outside is so much safer than inside. And of course, wearing masks are absolutely pivotal in our success in any and all of those social get-togethers. Now, there are exceptions to this change that won't be affected, at least for right now, including spiritual services, weddings, and funerals, which act under our existing guidance. So, anything more than 10 from outside your household is not allowed in phase 3. In phase 2, anything more than 5. And I do want to emphasize, even limiting the number of people that we socialize with does not remove or reduce the imperative nature of mask and social distancing. So just a note on the kind of things we're talking about. You know, this is somewhat of a challenge for us because the kind of things that we have always treated as benign and innocent and healthy during the decades of our lives are now dangerous. Hosting backyard barbecues with too many people that would violate this order is now a danger. Having a picnic with too many people that violates this order is now a danger. Dining in a restaurant with too many people in dangerous circumstances can now become a danger. Birthday parties where people have become infected at innocent things like a birthday party. And I say these things because it's difficult for us to understand that. But as governor, I really have a responsibility to share with Washingtonians the thing that is creating deaths in our state, and it is these innocent social get-togethers. There's a story in today's Seattle Times that illustrates this problem perfectly. A couple in Tacoma had done everything right. For months, they were taking care of themselves. But they had a few close friends over in late June. It turns out one of them had COVID, transmitted to this couple and others before they knew it. That's the type of thing that we all have to be on guard against. So we cannot let our guard down, even as we engage in more activities. Now, I know this has been a long and frustrating process for all of us. We all have our individual stories. Mine is I haven't had a chance to hug my new grandchild, a little beauty named Annie, who I get to see her crawling now electronically, so I still get to enjoy her company. But it is hard not having a chance to give her a hug. But if we're going to save ourselves from increasing death, it's simply what we have to do. Now, there is a particular phenomena that is now occurring in our state, too, which I have to address. And that is we have had a really significant surge in COVID cases among younger people. I'll give you an example of that. From January to March, young people represented 22% of COVID cases. From May to June, they represented 45% of our cases. We are seeing an explosion of this pandemic in the younger generation. And we know that while younger people may not have the same rate of bad events, they can suffer them. Just as I was walking in here, I saw a story about an otherwise healthy 29-year-old who had lost his life. I heard a story of a person in Washington had to be intubated yesterday, healthy 25-year-old. So somehow we really need this age group to help us, help themselves, but help the rest of us too. And I'll tell you why. Even if young people were totally immune from this disease, right now, when they infect someone, they may not have a particularly significant problem. They, in fact, may not suffer symptoms at all. But when they go home and visit their parents or their grandparents or their uncle or their aunts, boom, they become a virus vector. And we, unfortunately, have to anticipate an increased rate of hospitalization as this young cohort of folks spread out through their communities and through their families. So we really need the young generation to lead us, and they are leaders. I spoke to a group of leaders from colleges and universities yesterday or 2 days ago who had a really good idea about how to say, look, there is hope for us. This is not something we can give up on, that young people can help protect those of their own age group who are immunosuppressed. They can wear masks. They can protect themselves when they're doing the essential business, and we know that young people do more of the essential business that does expose them more to potential viruses. So we know we can succeed on this if we have the younger generation who will lead us. Some may correctly note that these prohibitions on gatherings are largely self-enforced. So far, not aware of anyone being cited so far, even if we know there hasn't been total adherence. So allow me to make the meaning of this more explicit. If individuals, each of us, do not adhere to mask wearing, do not adhere to social distancing, do not adhere to these limitations on gatherings, today's rollbacks may be a forerunner to additional rollbacks. And we cannot rule out the potential for another stay-home order this year, and perhaps not in the too distant future. So how individuals respond to this crisis will determine what happens to all of us combined. These are individual acts of community responsibility that can save us all. And as I've said before, we don't have a vaccine, but we do have each other. And we're asking all of us to protect each other right now. Masking and social distancing and limiting your contact, as this order will require, altogether are our best defenses against this virus right now. We have some hope on the horizon. You may have read about some promising results from some vaccine trials right here in Washington State. But those are not in the immediate future. And all of us now have certain weapons that we need to use. You know, I want our students to go back into the classroom. I want our restaurants and businesses all to be open. I want our state budget so it's not hemorrhaging billions of dollars. And I want people to be healthy and long-lived. And we can accomplish those things if we abide by these simple principles. And we're calling Washingtonians to do that today. So with that, I'll turn it over to John for some comments. John.
Great, thank you, Governor. Really appreciate your leadership on this issue. I know public health people I've been talking to all across the state really appreciate the attention to the social gatherings that you're talking about, and appreciate the reduction in the number of folks who we are saying one should interact with in any given week. But we do know we're going in the wrong direction, as your chart showed. That's the case. As a matter of fact, on that chart you showed, Governor, about our rate being 115 cases for every 100,000 population in the last 2 weeks. That's actually double in the last month. So when you were talking about that rise there, that's actually double from June 9th to July 9th. And that's really concerning to all of us. It's something that's saying we should stand up and take attention to that, and not only take attention, but take action. You know, everything that we do as individuals, when we go to work, when we recreate, when we're being social, all of those things impact our ability to move forward as a state with the things that we want to. And we really can't go safely forward unless we all do our part. And there are many things at risk to this, as you say. We have at risk schools opening in the fall if we don't, with in-person classroom, if we don't get a handle on this, because right now it is just simply moving in the wrong direction and going to be too dangerous if this continues. So really this is about the impacts that we can all make and pitch in together and do that leadership that you've talked about for so long. So I know that we don't want to jeopardize any of the momentum, but we are jeopardizing the momentum and the gains that we made with the stay home, stay healthy order. So as you said, really what we need to do is decrease the number of people who are in contact with in those social environments. In talking with the folks in local public health and who are interviewing the people who are diagnosed with COVID, what we're hearing is it's these social interactions that indeed folks are starting to see become more apparent in the cases, including now we're seeing some of the impacts of the July 4th weekend activities. You know, it's now about 2 weeks later, and during that time period, that incubation period, that's when we would be seeing the cases. The people who are talking to the people who are recently diagnosed are learning a lot about these interactions as we talked about, whether they're birthday parties, a cocktail party, something that people feel is pretty innocuous. So we all need to pay attention. I think the bottom line is our attention to this can't be a part-time job. This is a full-time job. Every interaction we have to think about doing it safely, wearing those face coverings, keeping our distance. And if we do that, we can bend the curve again. And it's absolutely essential that we do that. So thanks, Governor, for your words around this and the leadership we're taking today.
You bet. And that word leadership, I think, is important. I will note that I think all of us have some leadership capability here. You know, whether you're a parent of a 19-year-old that wants to go out and party during the night and is going to be with 50 other people, look, there's a leadership position. If you're a 19-year-old and you're going to go to a party and you think, you know, maybe that's not the best idea to not be socially distanced, that's a leadership position. And we're really hopeful people do show leadership. Lastly, I'd like to draw attention to the fact that Congress needs to pass another stimulus bill. They need to do it now. We have so many people who need financial support now. They're making good use of the extra $600 in their unemployment benefits, and those need to continue, and Congress needs to move to do that. We are hopeful that Mitch McConnell timeline for the aid is not followed, because it would be too late. We need assistance now. This pandemic is not going to go away by the end of this month. We know that, and neither will the need for aid, both for individuals and for states, so they can do their business. People need help, businesses need help, communities need help, states need help. So I have one simple message: pass the damn bill so we can do our job and take care of our people. With that, I'd like to stand for questions.
First question comes from Rachel with Vicky. Governor, you've warned of potential additional rollbacks. Can you give specifics of what activity could be modified short of a stay-at-home order?
Yes, these are not decisions at the moment, but we would have to look, if this trends continue, even in the short term, if these trends continue, we would have to look at the things that are least problematic for people's daily survival, least essential for our economy, and most dangerous by bringing people together in social settings. Clearly, those would involve bars. Those could involve indoor dining at restaurants. They could involve other recreational activities, bowling alleys and the things like that. The things that were the last things that we had to shut down would be the first things we'd have to go back on. And why? Because science may dictate that. And the science is that this is a trajectory of tremendous danger and fatalities that we're on today. And we will have to be confident that our new measures of masking initiatives, this restriction, additional restrictions on social gatherings, and evidence that businesses are complying with the masking requirement would be enough to reduce this rate so that we can go about opening our schools and the like. And, at the moment, that's a great question. So we're taking action in the last few days in our masking requirements. We're taking action today. But I just have to make sure people are aware that something has to change fairly significantly, or we're going to be back been to the soup just like we were in March and April.
Rachel, would you like to ask a follow-up? Yeah. Schools, you spoke with School Superintendent Reichdahl yesterday. Can you just talk a bit about what that discussion entailed and whether there were any decisions made?
So there were not any dramatic decisions made. We talked about the status of the school district discussions and planning primarily. I talked to a number of superintendents yesterday morning and then the superintendent yesterday. And as you know, basically he and the departments of health have set forth templates about how to go about education in this fall. And they set out basically some requirements that we will need to meet in order to be able to do that. Requirements about distancing of students, of hygiene, of screening of people. And so we know what those requirements are, and the school districts are now considering those to figure out how to go about education in the most successful way, taking those into consideration. And at the moment, it doesn't appear that those plans are set in concrete. We know that many of the districts are looking at hybrid plans that would involve a certain number of days in classroom instruction and certain remotely. There's also a number of school districts have told me they would consider an option where parents, if they wanted to, could opt for remote instruction. And there may be some schools that have found a way to do it with total on-site instruction. So at the moment, the situation is districts are trying to make individual decisions that are consistent with their own community settings, and that those discussions are continuing. There are discussions with a variety of the community, parents, educators, and the leadership of these school districts. So the state is continuing to try to figure out what works on a community by community basis. But I do want to perhaps reiterate what is maybe obvious, our ability to open schools is dependent on our ability to knock down this virus. And as you noted, we're getting some good science on this subject to make scientifically driven decisions, because that's how we make decisions in the state of Washington. And following that science so far has been a very wise decision by the state of Washington, because we have avoided the horrendous scenes like we see in Arizona of people who have lost their lives having to be stored in ice trucks because the morgues were full. And because we have followed science, we have avoided those scenes in the state of Washington. So we're going to continue to follow that science. I saw a comment from the White House that they weren't going to let science get in the way. That's been an unfortunate attitude that is extremely dangerous. So that's one of the reasons we're acting today, to notify people that changes in social behavior are absolutely imperative in increasing the odds that we can have more on-site instruction in our schools. And I hope people help in that.
Next question comes from Joe at the Seattle Times.
Governor, two-part question for you. Regarding today's order, is this a signal that you view the larger gatherings as more of a threat in the Phase 3 county compared to the 5-person limit in the Phase 2 county? Is that not a trend at all in your mind at this point? And then, you still have lawmakers unhappy that there hasn't been a legislative session scheduled. On the Republican side, there are a host of concerns, constitutional, even some Democrats want to get back to Olympia. How do you justify keeping one of the three co-equal branches of government sidelined during this extraordinary pandemic so far?
So in answer to your question, no, I consider three counties is a reminder to everybody else in the state of Washington in Phase 1 and Phase 2. The cost factor of this disease. And as time goes on, this becomes more and more apparent. So we have done some things that have been proactive and successful in our business environment. What we found is what we have gained perhaps in this community, we have lost in the social setting. So each is equally important. I hope that this decision today will reverberate to all of us, because the things that we have found so typical and normal, today what used to be a birthday party can be a death sentence for somebody. And that's just a reality. And as time goes on, that becomes more and more apparent. So hence the decisions today. The need for a session, we do not need a special session right now, and the reason is that we have enough financial wherewithal to get to January where we can have a regular session with all of the good work that legislators can do. And the reason we are in that position, we believe, is because we have a $3 billion reserve account that is available, and we are hopeful that the Congress is going to act. And if the Congress acts together with our reserve account, those decisions may be relatively easy for this biennium come January. But it is not necessary to have a session right now, and there's no reason to have a session just to have legislators talking amongst themselves. Second, we don't know yet what our financial really underpinnings are, because we don't know what Congress will do. And it could be a $2 billion difference whether they act or do not act. And it doesn't really make a lot of sense to have stewing and arguing and speechifying when we really don't know what the fiscal position of the state of Washington is. And the third reason is I have asked legislative leaders, and it is clear to me that there is not a consensus or a way to pass a budget in some way that has majority support in both chambers. So for those three reasons, we look forward to success with legislators when they return in January, and I'm going to work very closely with them.
Joe, would you like to ask a follow-up?
Oh, that's fine. Thank you.
Next question comes from Essex of Cairo.
Oh, let me note, if I can add, can I add just something that, to Joe's answer that sometimes is forgotten? The other reason this is not necessary is that the state has already taken considerable actions to respond to the revenue downturn. I vetoed about $445 million of spending that I supported, that was new spending that was passed in the last session of the legislature. I supported 98% of that, but I had to veto it because we did have to do some things to tighten our belts. I also instituted a measure to save about $55 million in payroll with a furlough program that could grow to over $90 million if other statewide officials follow my lead. So we have already taken some action, and that is one reason why we are in a position to have these discussions in January rather than August.
Yes, Governor, because this is so important, why have you exempted weddings, funerals, church services from these new restrictions?
Well, we are hopeful that people will embrace this call for action in their social lives in these less structured settings. And I believe in listening to the local officials. It is these less structured settings where we're getting the huge increase in infections. It's the 20 people at a beach party, and I love beach parties and I love young people. But when I see 20 young people, not masked, shoulder to shoulder, it's dangerous. It's the folks in my generation who are going to a retirement party and have 20 or 30 people in a house. Those are the things that we think are the things that have increased in the last several months. And look, I understand why those things have increased. We are desperate. We are longing for human company. We want to see our friends, our relatives. It is such a natural thing, particularly after this length of time. But we in Washington understand that if you're going to win a battle, sometimes you have to be in the battle to the end. And that's the situation that we are in right now. So those social settings is where we think some of the biggest transmission has been. Now, this does not eliminate the possibility that we will have to impose the same restrictions on those more formal settings at a later date. And as I've reiterated, unless something changes, we will have to make more decisions that are difficult. So we hope everybody bears down right now.
Yes, a follow-up question for Secretary Weisman. Knowing what you know about the numbers and the fact that school is going to start opening in 6-7 weeks or so, should school districts be focusing more of their time on figuring out how to do remote learning and less of their time on trying to figure out how to do it in person?
Well, maybe.
What I really hope people focus on is that they focus on at the moment about what each of us can do individually to help assure that kids can attend school in person and do the things that we've asked folks to do. And as the governor said, those things are things that each of us can do and take responsibility for. And as we've also said, we know the need for social interaction and want to continue to encourage people to do those Zoom happy hour parties or birthday parties where people can stay connected. And then if they are in those small gatherings, to make sure they're wearing their face covering and making sure they're keeping their distance. And it's prudent for schools to be planning for the whole spectrum, and I think that's what they're doing. That's the right thing for them to do. And again, we can do our part by helping them be able to get kids into the classroom by 100% of our time taking responsibility for our personal interaction.
Governor, the White House coronavirus task force received a report this week, state-by-state analysis, and for Washington, it recommends and suggests moving to some pool testing, some community-led neighborhood testing, and some changes in the process. Are you folks concerned considering that?
Yes, there are several of our local labs in the state of Washington that are considering that. In order to do that, they have to get the approval of the federal government. So the sooner the federal government gives us approval of that, the sooner we can use this pooling strategy. I spoke to one of the commercial labs yesterday about this, the CEO of one of the commercial labs, who also believed that this makes sense. This makes sense when you have lower rates of transmission. We do think that in certain of our communities, we have a low enough rate of transmission where pooling makes sense. So yes, we are considering that. We're in the process of getting approval for embracing that strategy. And the faster the federal government helps to approve that, the faster we can embrace that strategy.
Jerry, would you like us to follow up?
Sure. Is another, looking at this report again, there's also a suggestion to government should look at innovative ways to monitor compliance with some of the restrictions. I'm wondering, in light of today's announcement, what innovative ways might you guys be considering to enforce the gatherings beyond the voluntary compliance?
Well, I think one of the innovative ways we could do it is to stitch a mask around the president that is permanent so that he does not continue to create deceit, dysfunction, and disengagement, so we can go about saving lives. That would be handy and quite innovative. Now, we would only do that with his concurrence, of course, but I say that, tongue in cheek, but look, we could use some national leadership here. That would be innovative. We're starting to get a more bipartisan approach in our state and across the country. Mitch McConnell, Republican senator, is wearing a mask. Congressman Dan Newhouse, Republican congressperson from Central Washington, wearing a mask. Multiple Republican mayors across the state of Washington, including Eastern Washington, are wearing masks. I want to give credit to some of those leaders, Commissioner Delvin in Tri-Cities and others. Our most recent survey in Benton County and Yakima showed a huge increase in those that are wearing masks, and they have been innovative in a mask up campaign that is bearing fruit. In Yakima, the usage was only about 35% about a month ago. There's one survey showing it's up to 95% now. That might be overly optimistic. But the point is, we have a lot of local leadership. It'd be nice if we had national leadership on this subject. As far as the innovative ways to make this work, we have been innovative. Our state was the very first state, I believe, to create a requirement that businesses not serve people who are not wearing masks. Other states are now following that policy. I think Michigan may have done that yesterday. So that is innovative. And we will have a communication effort that has or will shortly begin to talk to all the communities where they live about why this is helpful. And I think you'll find some innovative way to message that. So we're innovative. We're going to be innovative throughout this program.
Next question comes from Drew with Impact.
Afternoon, Governor. Do you have confidence that schools can make campuses safe for reopening, whether it would be this week or in September? And if you had school-age children, would you feel comfortable sending them back to a school anytime soon?
Well, I have grandchildren, so they're pretty good proxy. I'm confident that the local districts are really exploring all the options to do this in a safe way. I think there is a possibility that they can do that, particularly in this hybrid model, which would give schools a way to spread children out. It may mean they only have 2 or 3 days in class, but they have remote the rest of the time. I think that does have promise. So I would not rule out the ability to have some on-site education for kids I care about. But again, this depends on the progress of this pandemic. And if we want our kids in school, the fewer people in bars, the more kids are going to be in school. And that's what this is all about right now. So we remain very hopeful. And I do want to say, I think the districts are really exercising thoughtfulness and creativity. I've seen some things where people have stretched to do things differently, to explore every part of the school building that they could use. Obviously, improving remote learning opportunities is really important, and they're being as creative as possible. But we have to realize remote learning is not always totally equitable. Children without great broadband access, children with disabilities, it's much more difficult for them. One of the things that I talked to one district the other day about is to have children with special education needs be in the classroom 5 days a week so that they would not be jeopardized by having to go remote. That sort of made sense to me. I just want to tip my hat to the districts trying to work through these very difficult challenges.
Drew, would you like to ask a follow-up?
If your grandchildren's districts did feel safe to open, you would send them back in September?
Yeah, yes, I think they're going to make reasoned decision, and the district that my grandchildren are in are providing them a crackerjack education that is wonderful. The work that the educators are doing, I can't tell you how thrilling it is. I'll give you an example. I have an 8-year-old granddaughter. I was talking to her the other day, and we were talking about what she likes to do. Well, she likes to write. And I said, well, what kind of writing do you do? And she says, well, you know, I do narrative writing. I do objective analysis writing. I do advocacy writing. So there are many different styles of writing, and I do different types of styles depending on what day I'm in and what the context is. I mean, I might have learned some of that in my 3rd year of law school. I'm blown away at the education young people are getting, and I am impressed with what educators are trying to do right now.
Next question comes from Jim with the Interview.
Governor, I'm wondering how long will you wait to gauge whether these latest rules are effective, or you might need something else, considering that the chances to see what's happening from exposure to infections on next Monday when these go into effect, they may not show up for 2 weeks, given the time it takes for symptoms to show up and the test to be processed.
These are the questions that are unanswerable. I can't give you a specific date. What I can tell you is every single day we evaluate these situations. Now this morning I had some news that was very concerning. There's preliminary numbers of infections announced today, over 1,000 for the second time in about a week. We don't have the full date when those infections took place, so we don't know to what date to really ascribe those. With an over 6.5% positivity rate, which is higher than it has been in the last month. So this morning's data was disturbing to me, and we just look at that every single day. So I can't give you a date or a time. It's when we make a decision that we have to be more aggressive to have a higher level of confidence that we're going to knock these numbers down.
Jim, would you like to ask a follow-up?
But just to be clear, you won't be waiting weeks to make this decision, it doesn't sound like.
Not necessarily. Just not necessarily. We could make a decision tomorrow if we saw some things in the data that made it clear that that was the right decision. Or it could be weeks before there's additional changes. You just have to judge this on the condition of the patient. It's like asking a physician, when are you going to make the decision to do the surgery? It depends on the condition of the patient. And we hold 7 million people's lives in our arms, to some degree my arms right now. And I take that very seriously, and I evaluate it every single day. And we're going to make decisions based on science, not ideology, or trying to avoid hard decisions.
Governor, as far as the numbers that are coming out, just looking at Pierce County, 89 new cases. When you were allowed them to go to phase 2, they were averaging in the teens. When is it going to be time for you and the Secretary of Health to take some of these counties and force them back to phase 1 or phase 1.5?
I would give exactly the same answer I gave to the previous question. When it's the right decision, that we are confident that what we are doing are not achieving the desired goals. And today we're taking some action that will increase the ability to reach those goals. Tomorrow we may have to take some more action depending on what additional metrics are coming in. So I would tell you that we will make those decisions at the right time. And I think by and large we've done that throughout this effort. And so all I can give you is the value statement that we use in making these decisions. And those values remain unchanged. We value human life. We value science, we value fairness. And when those three things suggest we need to move, we will make the right moves. And we are not timid or afraid about controversy. That's deadly right now, to be afraid of controversy. We have to act sometimes. So at the right moment, we will take further action.
Governor, we were at Lake Washington over the past several days, and there were large groups of young adults who were out on the boardwalk. Some of them told us they don't care. What do you tell them, and is it time to take more stronger enforcement of your mask order and your crowds order?
Well, I got to tell you, this is a difficult thing to talk about because I'm 69 years of age, and when I see young people, I'm immediately jealous of them being in perfect health, the bloom, the rose of youth, with not a care in the world. You know, I'm kind of jealous of that. And the last thing I want to be seen is the guy saying, "Get off my lawn." I don't want to be in that position. And you can't ascribe the whole problem to the young people of the state of Washington. Look, one of the reasons they have a higher infection rate is they do a lot of the work that's on the lower end of the pay scale, where they have a lot of interaction with people. They're the people serving you coffee and ice cream at the grocery store, and so they're exposed more than the older generation. So I'll defend them to a certain degree. However, the fact is that we are simply seeing a behavior that is way too risky, exactly the kind that you're talking about. I'm seeing it many, many places that I go, and it's really troublesome to me. All I can tell people in that situation is that the motivation I would hope you would have is, if you really don't care a lot about your own life, and if you think the odds are with you, fine, but you're taking that home to your mom and your dad, and you're taking that home to your grandpa and your grandma. And if the life of your grandpa and your grandma or your mother doesn't motivate you, then I don't know what will. And I just hope that people start thinking about that a little bit. It's one of the reasons we're taking action today. And it is the motivation to help your loved one that eventually is going to get people to show some responsibility. If people don't care about their grandma, then heaven help you. I can't help you. You're helpless. And I just hope people start to think about in those terms. Now, could there be enforcement action? Yes. So far, it has not been really useful to do that. We are taking some enforcement action against this business in Chelan County. If businesses don't enforce the masking order, there could be enforcement action in those contexts. But for individuals, this is an individual issue of who you love and who you care about. And we hope Washington show that in the next few weeks.
Time for a few more questions. Next question comes from Alexis with the News Review.
Governor, can you respond to the Trump administration's order that had to do with hospitals bypassing the CDC when reporting patient information, and what that might mean for our state?
Well, it is very disturbing because the administration under this president, unfortunately, has a history of first denying the problem, then disengaging from the problem, and then trying to deceive the public about how bad the problem is. And so when they do something like this, it's very concerning. The CDC is the group charged with this responsibility. I can see no reason to deny them access to this information, which are the experts on this, other than some motivation that is unpure. Now, unfortunately, I shouldn't say unfortunately, we know the president views himself in great political trouble, but that should not justify denying the public the protection of the information that is the most important information, intelligence information we have right now, which is how to beat this pandemic. And this information is gold. Look, the decisions we make on a daily basis depend on accurate information, much of it from the CDC. So we should all be very disturbed by this. We would hope Congress could act on this to try to save us from a person who doesn't want to know us how severe this problem is. And that's a sad fact right now.
Alexis, would you like us to follow up?
No, thank you.
Last question. Final question comes from Ashley with the
Hi, Governor. I'm wondering, last week I asked about why there wasn't a closure to the state's coastal beaches ahead of the 4th of July holiday. And you said that there wasn't really a serious discussion on that topic. And you mentioned Ocean Shores, which is actually in Grace Harbor County, and I'm in Pacific, but was a good example because last Monday, since last Monday, Grace Harbor has seen an increase of 22 cases, raising its total number of confirmed cases to 56. Long Beach is also part of a pilot program to map our COVID-19 spread by testing our sewer systems. The day after the 4th of July holiday, up till the 4th of July, our sewage tests did not detect SARS-CoV-2, the virus that causes COVID-19. But on July 5th, the day after the 4th, the sewer test showed an estimated about 30 people in the city were shedding the virus. So I'm just curious, why wasn't there more serious discussion about closing the beaches prior to the holiday, given how popular a destination the coast is for the 4th of July?
Well, I guess one reason is that I'm not omnipotent. We're doing everything we can to save lives, but I haven't been able to have a decision-making for every 100 yards in the state of Washington. And, we just did not consider that being at that level of risk that justified additional decision-making that was specific to the ocean beaches. But you raised some really interesting information. I had not heard that information you just shared with me. I'm going to go back and ask the health departments about that. And it might be a situation where it does call for additional closures at a later date, depending on what the data shows. And this comes back to what I've been saying, is that we follow the data. You've just given me some data points I find very, very interesting. So I'll be and I appreciate you sharing that with me.
Yeah, I do just have one follow-up question, Governor. I think you raised a good point that you said that, I'm not omnipotent, and that you can't plan for every 100 miles of Washington. And, Pacific County is a rural county. It's 22,000 to, the top of its census. But our legislators are really informed on the issues that are important to us down here. So I guess I would just go back to say, wouldn't that be a benefit of having the legislature in session, that you would have these people who live closer to these counties that your staff just couldn't possibly have the capacity to know every detail or every issue that's concerning to the area?
No, it would not be, because there's nothing special about a special session that already doesn't exist. The legislators can pick up the phone and call me anytime. The mayors can call me at any time. The county commissioners and executives can call me at any time. I don't recall any of those local leaders urged us to close the bridges before, or the beaches before that. I will check to confirm that, but I don't believe any of the local leaders requested that before the July 4th. I will check on that, but we have open communication without the necessity of a special session. The phone system is working and works really well. So I will check on that, but I don't think, now that may change. You've just given me some information that might give us a new viewpoint, including some of the local leadership. So we'll continue to look at that.
All right, any final words, Governor?
No, I want to thank everybody. Just wash your hands and mask up and care about your grandma. Thanks a lot.